Hello everyone, and my name is Carla Arevalo, and today I will talk a little bit about my PhD project, which entails the study of diabetes in heart failure patients. It is widely known that diabetes is highly prevalent in heart failure patients. In several clinical studies, around 30% of heart failure patients are also diagnosed with diabetes. So there seems to be a correlation between heart failure and diabetes. But until now, we are not really sure what happens when these two processes coexist. By understanding the pathophysiological mechanisms when these two diseases are present, we will identify novel treatment patient-specific targets. And this is what my PhD is about. I will do so by studying the transcriptomic signature or the gene expression levels of heart failure patients with and without diabetes. After identifying differentially expressed gene targets, we will test their effect in an in vitro model, and for this we will use a stem cell derived cardiomyocyte. Up to this moment, we have performed the transcriptomic analysis, which in other words means that we have analyzed the differentially expressed genes in whole blood from heart failure patients with and without diabetes. And for this, we have used the Biostat cohort, which is the biggest transcriptome dataset for heart failure patients. We had around 944 patients with heart failure, from which 301 were diagnosed also with diabetes. As you can see in the volcano plot, we have identified several up and down regulated differentially expressed genes. It is worth to mention that after performing the pathway analysis, we have discovered that most of these genes belong to the metabolism pathways. Now that we have identified several interesting genes, we want to test their effect of up and down regulating these gene targets in a stem cell derived cardiomyocyte. This means that we will use pluripotent stem cells, and after a differentiation and maturation process, we will assess changes after up and down regulated these gene targets. We will assess changes in a 2D level by analyzing morphology, metabolism, electrophysiology, and at a 3D level by assessing changes in contractile force, sarcomere organization, and relaxation pattern. In the end, what we hope my project will contribute to precision medicine is not only unveiling novel pathophysiological pathways, but also it will help us to identify patients that would benefit from a tailored treatment strategy.